Hello and welcome to the demonstration of the Palliative Toolkit that has been developed by the eHealth Center of Excellence. The overall goal of this toolkit is to help with early identification of patients that may benefit from a palliative approach to care, and also providing some resources for the patients depending on what phase they fall into based off of the Palliative Performance Scale. Today's purpose will be to actually go through the tool and go through all the different workflows that can be done and explain some of the context around how the tool works. So we'll begin with the, in the EMR here, you'll see that I've loaded up a patient chart here. And along the top, you will see that for this patient that the palliative toolbar has shown up automatically. There is criteria for when this toolbar is going to show up, and that criteria is found in what's called a reminder in PS Suite. So if I go to the reminders and I find our reminder, then you can see the different pieces of criteria that will cause this toolbar to show up. This criteria has been taken from the gold standards framework, and specifically the early identification and prognostication guide that has been adapted for Waterloo, Wellington. So we've taken those indicators that we'll talk a little bit more later and put them into this reminder here. So if the patient happens to have one or more of these conditions here, then this toolbar will show up. The intention of the reminder is to be to cast a wide net so that it's actually up to the clinician's judgment whether this patient actually would benefit from that palliative approach to care. So back to our patient chart, we've loaded up the toolbar. The first question that a provider may ask is, why is this toolbar showing up? So the first thing you can do is you can click on this little clipboard here, and this will pop up a form that will just give a bit of a summary for why this patient is showing up. So this is the criteria that has been taken from that reminder that we just looked at. And so you can really easily see here that the reason that the toolbar is showing up for this patient was because it found COPD, liver disease, and cancer in their problem list, and they also actually meet the criteria of being over the age of 90. So again, you only need one of these pieces of criteria for it to actually show up, but this just gives you sort of an overall way that you can see exactly why it popped up. After seeing maybe why the patient actually was flagged, the next step is to actually click on the palliative button. And by clicking on the button, it's going to ask us the surprise question. So the surprise question is from that gold standards framework, where it will ask you the question, would you be surprised if the patient were to die in the next year? According to that gold standards framework, there actually are different workflows that are done based off of your answer to this question. And I'm going to go through all three of them just to show you what that looks like. So the first workflow we'll look at here is if I were to say yes to this question. And what this means is I would be surprised, therefore maybe this patient wouldn't necessarily benefit from a palliative approach yet, but they might in the future. So I'll click yes here, and when I do that, a new window pops up called Palliative Reassess and for Advanced Care Planning. And so you can see there are basically two components to this form here, a reassess option, where we have 6 months as the default, but the provider can put as many months as they'd like if they'd like a custom amount. This reassess option here is going to specify when the toolbar will actually show up again, so that it doesn't actually have to show on the chart for a while, but in 6 months it will automatically pop up. Additionally, there are some additional tools here. Even if the patient wouldn't necessarily benefit from a palliative approach right now, there are still some additional tools that would be useful in completing. So the first tool is the Substitute Decision Maker tool. This tool is used by a variety of providers already, so we have provided it as included in this package here. So you can fill out this tool here. You'll see that it has been filled out in the past, so it does pick up the previous information. If this were my first time doing it, I could say add to notes and include it in the chart. And you'll see that because I had done it before, it'll show you when it was last done. And there also is this palliative performance scale, which we will go into a little bit more detail with soon. So in this case, I'm going to say finish with this workflow. And when I say finish, you'll notice that the toolbar has disappeared from the top and that this custom vital has gone in at the bottom. So just to simulate what it would look like if I had maybe done this, I'm going to do this more than 6 months ago, just to see what it would look like once the time has elapsed. So I'm going to put 2018 as pretending that I did the note then. And when I load up the toolbar or load up the patient again, you'll see that the toolbar actually does reappear, and it does say reassessment due in yellow. And when I click on that button, it's going to ask me the surprise question again. So I'm just going to take a second to reset and go back to our original surprise question and go through the other two options. So again, we come up with the surprise question. And in this case, I'm actually going to say, no, I would not be surprised if the patient were to die in the next year. This is a great indication that the patient would benefit from that palliative approach. And so the next logical step here is to fill out a palliative performance scale. So you'll see that the message coming up here, the tool will look in the chart for a palliative performance scale. And if one hasn't been done in the past, then this message will pop up, basically indicating that, that a new form will pop up. And when you're done, just clicking on the update button on a palliative form that's going to go in the chart. So we'll see that in a second. So I'm going to say OK here, and we'll see that the palliative performance scale pops up. For those unfamiliar with this form, there is a blue link at the top that says, how do I use this form? And here there are some instructions for how to fill it out. And for those that find it easier to follow, there are some video instructions as well. I won't go into full detail of how to fill out this form, but the ultimate goal here is assessing a PPS level. And so depending on the PPS level that the patient is in, that's going to change what phase they're in and therefore what resources are most applicable to them at this time. So between the PPS level of 100 and 70, that is what's called the stable phase. Between 60 and 40 is known as the transitional phase. And between 30 and 10 is end of life. And you can imagine that there would be different resources depending on what phase that you're in there. So the basics of the form, though, is that you go left to right, and you can click. You don't have to be all in one column. You sort of look in for each one, which makes the most sense. And at the end, you're assessing a PPS level. So hopefully that we're identifying the patient early on, that we're assessing them early, so that you're getting them in the stable phase. So something like maybe a 90% or 100%. In this case, I'm going to say 90%, and I'm going to say add to notes. When I refresh my form here, you'll see that the button along the top has actually changed to palliative stable, so that it's a nice, easy and visual for the provider to see that this patient has been identified as a patient that will benefit from a palliative approach to care, and that they're currently in the stable phase. And you'll notice that a new form has gone into the chart, and this is called the palliative main form, and it's actually a special note. So it will go in once, and so you won't need to be entering in this form multiple times. Use this as sort of the central hub for all of your resources and tools to help manage the patient moving forward. So without going too much into detail around how the actual form works, this completes the workflow if we were to say no in that original surprise question. So I will reset one more time, and we'll go back to the original question. Would you be surprised if the patient were to die in the next year? And this time I will say not sure. When you say not sure, the workflow here will be that the tool will pop up general indicators of decline, which is this form, and if needed, will also pop up a window called specific indicators of decline. So these indicators, as I had mentioned earlier in the video, are taken right from the gold standards framework and are really just some indicators for the clinician to look at to determine whether this patient would benefit from that palliative approach. There isn't anything in the framework that says it has to be 2 or 3 or 5 of these indicators. It really is up to the clinician's judgment here. So we're trying to provide a little bit of decision support for that clinician to answer the question that's at the bottom of this form. We do provide some tools on the right-hand side for that decision support that helps with these indicators. For example, one of the indicators is a weight loss of greater than 10% in the last 6 months. So what we're able to do is the clinician can click on the weight graph and can actually make that assessment whether the patient has that indicator. Similarly, another indicator is this declining functional performance, where it's a palliative performance scale of less than or equal to 60. So we provide that scale so the clinician can fill it out and see if they are. Finally, you will see that there is a lab value of this albumin here, and it will actually pull that in as well. So ultimately, the clinician has prompted this question at the bottom: are there general indicators of decline and increasing needs? If you say yes, then it's going to insert that palliative form we saw before directly into the chart, basically saying that yes, this patient would benefit from a palliative approach. If we're saying no, that's really saying that we're not sure yet. We need to see some more specific indicators to make that decision. So when I click no, you'll notice that the next window pops up. So the way that the specific indicators work is they are broken down into categories, and then depending on the category, further into subcategories. So the goal of this form is to provide these indicators in a clear and concise way without overwhelming the user with indicators that may not necessarily apply to this patient. So for example, we'll click on cancer to see some of the indicators. You can see that they load up in this middle part right here. So similar to the general indicators before, the clinician is able to look at these indicators and assess if the patient does meet them. You'll see with the second option or second category here of organ failure that there are subcategories. So COPD, I can click here and I can see the indicators that are specific to COPD. Throughout the tool, there are these learn more buttons as well. They're shown for things where there might be grades or calculations that might not necessarily be top of mind for the provider. So these just learn as a little bit of a reminder on what grades look like or what different indicators mean. So you can see here that here's the definition here for the MRC grade 4 to 5. I won't go through all the different indicators for all the different diseases, but you can see that it's as simple as clicking on them to get more information. You may notice that there's the problem list in the bottom right corner. This is just a great indication or a great visual aid for the clinician just to see here and make sure that they are going to the specific subcategories or sections that are in the problem list. So ultimately, it does come down to the question, and again at the bottom, do they have specific indicators of decline? A yes is going to put the form into the chart, and a no is going to bring us to that advanced care planning window, which we saw in the first workflow. In this case, I'm going to say yes and insert the form into our chart. You'll notice that because I had completed a palliative performance scale when I was demonstrating another workflow, that it was already in the chart. So this form does automatically pick it up and will change colors in both the button along the top of the toolbar and in the actual form itself. So that completes really the first part of the tool, and that's the early identification of palliative patients. So now we're moving on to the second part of the tool, which is around giving the clinician and patient resources in the management moving forward for this patient, given the phase that they're in. So you can see that the form has several blue links and certain pieces of functionality, and I'll just go through those one at a time. So you can see in the top left corner that we have the palliative performance scale. This is just a link to that form that we'd seen before. Additionally, below that, we have the palliative SOAP form. And this is also where we're going to be doing our billing and our visit note. So when you click on that, it opens up a new window that provides the provider to fill out their normal SOAP note, and then includes the billing component piece to your palliative visits as well. So as part of, and we'll talk about it in a second, the K023 below, you do need to document a start time and a stop time. So we provided 2 separate boxes for that. And then as you see below, we do have 2 of the most common codes that will be used for palliative visits. And that's the K023, which is for a palliative care support visit, greater than 20 minutes, and the K015, which is a counseling of relatives. So these are the most common codes. There are certainly many more codes that we'll get to in a second, but we think that these are the ones that will be the most used. Below that, there are some additional links that will help with a little bit of the context and provide some more information around some of the billing pieces. So for example, if I click on the billing summary for office visits, this is going to provide some detail around the specifics for what a K015 and what a K023 entail. Additionally, below that, we have the special premium bonus information window. So this details that if a family physician documents at least 4 K023s for 4 distinct patients in a given year, then they're eligible for a bonus of $2,000 per year. And this is actually a direct OHIP payment, so you don't actually have to submit a separate code to get this. And it may not be applicable to everybody, but physicians in certain patient enrollment models actually have a slightly higher bonus if they have 10 plus palliative care patients. We also do have the full palliative billing guide below. This will open up a PDF that shows extensively how billing works for palliative. This would certainly not be something that would be used on a daily basis, but is there as a reference in case specific questions do come up. Lastly here, you can see there's a Show Additional Codes button, and when you scroll down, you can actually see several other codes that could be used for palliative billing. And again, this isn't completely exhaustive, but these would be sort of the next level of codes that may be built for those that are familiar with them. So examples of these include special care consultations, house calls, special visit premiums, filling out common forms, things like that. So we do actually provide the ability to bill easily from here for those that are comfortable and familiar with that. Moving on, you will notice that in the top right corner over here, we have additional assessments that are important with palliative patients. So we have the ESAS, this is the Edmonton Symptom Assessment System. So this is kind of a standard for documenting how the patient is feeling for these different categories. And you can fill this out and it will create a custom vital that's nice and trackable. We do have additional forms, including the PHQ, the BPI, the brief pain inventory, and the substitute decision maker tool, which we saw before. All of these tools can then be tracked using the flow sheet, which you can see is just on the next level down here. So when I click on flow sheet, you can see that these values have been populated in here. For those unfamiliar with flow sheets and practice solutions, this is a great single view where you can see different forms and assessments kind of in one column and their latest value and their last done in another. And then additionally to the right, you can actually see a history of when these have been done, and when applicable, you can see a value as well. We're also able to track custom vitals. So for example, the PHQ form above here will generate a custom vital of PHQ-9. So it goes in as a standard, it goes in a standard way every single time, so that when I click on this, I can actually graph and see how that value is changing over time. When applicable, our forms always generate custom vitals so that they are always in a standardized way. Moving on to the summary section, this just gives a little bit of a summary for what has been done so far with this patient. So for example, it will show when the date that it was inserted into the chart, so you can see that's today. what phase they're identified, which could really help with some of the evaluation, and hopefully we're identifying patients early on. And then you can just, as kind of a reference, see the criteria that was matched when you first look at this patient. There also is a section for additional notes for anything else that may be worth documenting. Finally, for when it's applicable, there is a section for a care team as well. Sometimes this care team would have additional people involved in it. So for example, you could put an NP in here and maybe an NP phone number. So you have these custom labels that you can put here and then document that in the text boxes provided to the right. And then any additional notes can be put in here. Moving on to the right, we have in the middle here this phases section. So right now you can see by default that the resources that are being populated below are based off of the current phase. You also are able to click on the All button, and when you click on that button, it will actually open up all 3 phases and all of their resources. And there are multiple reasons that you may want to do this. And the first one may be that if you've documented something in a previous phase, like for example, if I had documented something in the first phase, but I was currently in the middle phase and I wanted to go back and look at a history for when I did it, you can use this All button to go back and do that for as a bit of an audit trail. Secondly, there may be a resource that isn't in the current patient's phase that maybe for this patient does apply to them and you would want to access that. And so you can do that by clicking All. For example, if I wanted to do something like the Hospice Waterloo programs and services, which isn't in this current phase, I could just do it like this and click it here. Finally, on this view bar, you can see the indicators. We have the general and the specific indicators. This is really just a reference for the clinician. So you can open it up and just see. There isn't any other additional documentation involved in these. So we finally arrived to the actual content of the palliative form. So starting on the left-hand side, you can see that we have this goals of care end-of-life planning box. This is just an open text box for the clinician to enter this information in. You can actually, when you document in this section, you can pull this information into other phases if you so choose. So I'll just demonstrate this by clicking All. And you can see if I wanted to copy from previous stages, it will bring it in. Or if you'd like to keep them separate, then you can do that as well. In the middle section, you'll see that this is really sort of the heart of the form, and these are the resources that are most applicable to the patients given their phase. So you'll see that there's lots of blue links. When you hover over them, it will give an indication of what type of resource this is. So for example, this is a custom form that will open up so that you can add it to the chart. This is a web link that will actually bring you to a website. And this is a PDF or a handout where you can load it up as a PDF in Adobe or whatever PDF viewer you use, and makes it easy to print for the patient. So it's as simple as clicking on it. And for example, here you can see the advanced care planning conversation. I can type in information into here. And when I'm done, I can say add to notes. In my actual form, when you want to actually document something, that's when you click on the checkbox here. And you may have noticed that for when we were going through looking at the different phases, that when you do check it, on the right-hand side, it will record what date it was done as well. This can be overridden by right-clicking on the date and choosing a date. If this wasn't accurate to today, the checkbox to the left-hand side is really just a shortcut to put in that date and to document that this has been done. So you will notice here that, so I'll click on All just to see that it has brought over the two, it has documented the 2 forms that I did in this phase, but for something like the Cancer Support Center, which is not in the middle phase, you won't see it there. Over time, as you click more, these will start to fill in. And you'll see that it will bring it into each phase. To give you a quick example of what it could look like for the other phases, I will just quickly modify my previous palliative performance scale to go back to 50. So now I'm in the transitional phase, and I'll update my form, check in the chart, and you can see that the resources have changed. So I'd like to thank you for watching the Palliative Toolkit demonstration, a tool developed by the eHealth Center of Excellence. If you would like more information, please email me. It is justin.wolting@ehealthce.ca. Thank you.